Welcome to Trulyfit, the online fitness marketplace connecting pros and clients through unique fitness business software.
Dr. George, thank you so much for joining the Trulyfit Podcast. We're here to discuss your book, Health in Flames, which I thought was an amazing book. And because I probably agree with 90% of the book, maybe there's a little bit of pushback from some of the things we could change in the medical industry. I thought it would be more fruitful of a conversation for me to play a bit of an antagonist here, a devil's advocate. So the format's going to be a little bit different. Audience, don't feel bad for him. He is certainly up for this intellectual sparring as my interlocutor. But I will be asking some questions that maybe push against some of the things you say in your book so that you can, further unpack that and prove your points. But why don't you give the audience a summary of your credentials and your sort of intellectual pursuits, and then also of your book.
Sure. Okay. Thank you so much for having me. First of all, Steve, I really appreciate the chance to come on your show and talk to your listeners. So a little bit about me. I'm a family physician. I work in Austin, Texas. I've been here for between 15 to 20 years doing a medical practice here in a fairly good sized multi-specialty group. So in that 15 years over time, I've, kind of taken on positions from chief of family medicine to eventually chief of population health for our patients in the Central Texas area. And what I learned is that from that vantage point, I kind of saw what a lot of my physician colleagues, I'm sure, are familiar with, a lot of healthcare providers are familiar with, and really a lot of people in the audience are probably aware of, which is that, rates of chronic disease are increasing year over year. Whether you're looking at rates of diabetes, hypertension, colon cancer, Alzheimer's, major depressive disorders, anxiety disorders, a lot of these various diseases are actually increasing year over year. And moreover, obesity rates are increasing as well, right? And so, it's shocking, to a lot of folks listening out there, but 73% of our adult population in the US is either overweight or obese at this point. And that is actually increasing year over year. And so, basically, what that points to is that the traditional advice that we've been giving folks, follow healthy diet and exercise, it's just not working. It's just, there's nothing wrong with the advice. It is something that is still foundational to good health. But for whatever reason, we're not able to implement that in our lifestyle. And so I kind of take a step back, take a look at the reasons for why we're not successful in implementing that, and propose a solution for doing so.
And you believe that consumerism plays a role in that, if not the major role in that. And I call it corporatism. I think it's just semantics here, meaning, what the corporations do as insofar as, pushing products to us that we may not need, and how we react around that. And that's I don't want to talk for you, but that's sort of more of the thesis of your book, correct?
Yeah, more or less, that's right. If you look at, if you mix our human nature, which by human nature we tend to chase after pleasures and mistake pleasure for happiness. On the one hand, if you mix that with the system of capitalism, on the other hand, then when you put those two together, what you come up with is what I term in the book mindless consumerism, which is this notion that we tend to overspend, chasing after things that are going to make us happy, but in the end actually don't impact happiness. And if it does so in an adverse way, in a negative fashion. So,
and I'm going to bookmark that, because that's going to lead into the intrinsic versus extrinsic that you talk about in the book, and we'll talk about that a little bit later. But I kind of want to start with some of the things that you start with in the book and follow that order. And you talk about death statistics right away, and we all die. And what could be a good possible death stat? Aren't all death stats bad? Give me a country that you say, oh, I want their death stats, they're better than ours.
So, I guess in the end, we do all die. So there is something to that. However, what I'd like to suggest is that a lot of folks, we can actually live a healthy life until we die. And that's something that we've kind of mistakenly assumed that with advancing age, comes chronic disease. It's automatic.
Mhm.
And in fact, there's evidence for that in many populations. That's not the case, that doesn't have to be the case. And in particular, if you look at prehistoric societies, pre-industrial societies, a lot of patient populations, a lot of those populations of people never develop the sort of chronic diseases that we develop into old age. Now, I don't want to minimize the improvements we've had. As a society, we've definitely achieved a longer lifespan. We've overcome infectious diseases, but as we've overcome these infectious diseases, we've kind of graduated from the diseases of poverty to the diseases of affluence. And so, we're not seeing malnutrition to the extent that we used to. We're not seeing infectious diseases to the extent that we used to. Instead, we're seeing things like diabetes and obesity and other chronic diseases, which I'd like to suggest again that it wasn't necessary that we have to take the bad with the good. There's a way to do it where we don't have to, that we can actually take the good and not have to take the bad along with that. You can have your cake and eat it too.
There you go. Well, speaking again about those companies and sort of the consumerism or corporatism, whatever we want to call it here, just semantics, and they do certainly take advantage of us. I had a PhD psychologist on the podcast the other day. It's not out yet, but it'll probably be out right before this, who worked for the food companies. And he explained how basically he helped them with their marketing from a psychology standpoint in making sure, let's say, the packages were of colors where our eyes send signals to our brain to tell us, oh, these are nutrient dense because they mirror colors of, let's say, a blueberry. And things of this nature. Now, what are, I'm a sticks and carrots guy. I don't necessarily think that you are, but what are some sticks that we can throw at these corporations or companies to stop them from doing this? Or do you believe that it is on us, the consumer, to make these decisions to not eat these?
That's a great question. So I could suggest that on an individual basis, any consumer can opt out of this toxic mix of factors, whereby we tend to chase things that are not good for us in the hopes of increasing our happiness. So from an individual perspective, each of us, we can actually decide on what we're going to buy or not buy, right? And so what helps to know is that there's a good degree of science behind what sort of things improve our well-being and happiness, and what sort of purchases do not. And I go into some bit of detail in the book about this, but basically, once you get past and this is oversimplifying the point, so I'll reference the book, but once you get past meeting your basic needs, that is, once you get past having enough food, shelter, clothing, water, all those security, all those basic needs, then the best things in life are free. That means that there's a lot of those. That means that instead of pursuing a lot of those purchases that then are likely to translate to less happiness, we can actually take that money, invest it, and get to the point of becoming financially independent, which opens up a number of possibilities for us, a certain freedom that we largely do not have in terms of today's society.
I love happiness studies personally. You cite a lot of them in your book. They make me happy to read happiness studies. And also, the contrarian in me tries to pick apart, well, what exactly is the definition of happiness? Because that is difficult to define, right? It's quite vague. And can you explain how you talk about in the book and the studies talk about the difference between like life satisfaction and emotional well-being as happiness gauges?
Yeah, that's really interesting research. So if you look back, there was a fascinating study that came out in 2011, 2010, 2011 by Daniel Kahneman and Agnes Deaton, who are two Nobel Prize laureates in economics. And what they came to find is that actually what all the headlines at that time said is that past an income of about 75,000, additional increases in income don't translate to greater happiness. So up until 75,000, the more you make, the better. After that, there's a very quick diminishing return on any additional income. Now, that's what the headline said, but that's not actually what their study showed. There was actually two different ways in which they defined happiness, as you alluded to. So the first was in terms of emotional well-being, and then the second was what they call life satisfaction. So emotional well-being, that's the sort of day-to-day happiness that we talk about. How are you feeling on a day-to-day, on a minute-by-minute basis? And that is what that $75,000 threshold was referring to. But if you look at life satisfaction, the research actually, what they showed is that life satisfaction continues to increase beyond that $75,000 threshold. And what is life satisfaction? It's basically asking someone how satisfied they are with their lives looking back. So instead of asking, how are you feeling right now? It's look back on the whole of your life and how do you feel? And what they found is that, beyond that $7,000 threshold, that life satisfaction continues to increase as income increases.
Yeah, and I'm just glad you brought that up and wrote that in your book, because a lot of people quote that Kahneman's study, specifically that 75K to happiness thing, and then they just close the book. They go, oh, that's it, 75K, everybody's happy. I don't know what everyone's worried about. And then, in addition to that, we also have the Easterland Paradox, if you want to quickly talk about how that factors in.
Yeah, so Richard Easterland, who's a professor in, I believe, California, he came up with this set of data that showed that if you look at past societies, so decades ago, a person who is wealthier than another person in that same society tends to be a little bit happier. But if you look at societies over time, that person, for example, we are much wealthier than we were, let's say, 50 years ago. Mm-hmm. But as a society, we've not increased in happiness to any significant extent.
And
actually,
also,
in the last few decades. Sorry, go ahead.
So isn't that also like a sort of a modern day comparison? Is like if you live on a street and everyone makes the same amount of money and you make a certain amount of money, but you're not necessarily happier. It's based off of the people that are surrounding you and how much they make, correct?
Yes, that's right. That's exactly the way to look at it, which is this phenomenon of social comparison. Mm-hmm. So we tend to, just by human nature, compare ourselves to those around us. If we're doing better, then we tend to be happier. If we're doing worse, and less happy.
So there's public intellectuals like Steven Pinker. There's a guy Michael Schellenberger, who was a mm-hmm. former environmentalist. Mm-hmm. And these are people who say, everyone's talking about doom and gloom and we have to worry about our society. And there's a sense of what they call alarmism. And they mm-hmm. go, you know what, just wait it out. Time will heal all. We'll have enough technology to fix everything. You disagree with that. Can you tell us why?
Yeah, I actually do. I love that book, Steven Pinker, Enlightenment Now, which is a great book. I actually agree with many of the things that he shows statistics-wise. Mm-hmm. So if you look at, again, rates of extreme poverty, it's dropped dramatically. Huge drops in extreme poverty over the last several decades, and in fact, over the last 100 years. If you look at rates of infectious diseases, again, it's decreasing. If you look at rates of infant mortality, you could look at all these various statistics, even levels of violence, and what you see is an improvement over time. And I don't want to put words into Steven Pinker's mouth, but his basic conclusion is that we can continue on the same path. And we should be able to realize further gains. Mm-hmm. Let's not be alarmed about, every single, step backwards when there's 2 or 3 steps forward that we will realize in time. What I'd like to suggest, though, is that, this is something that what has happened, if you look at some statistics that Dr. Pinker does not look at, which is the rise of chronic diseases, for example, then over time, we've actually grown unhealthier. Yes, we have grown healthier in the sense that we're not suffering from infectious diseases or the diseases of malnutrition, as I mentioned, but now we're just developing chronic diseases. Now, if you look at the traditional advice or the advice that our politicians give us, it's to spend even more. And by spending more, we will innovate. And by innovating, we will find cures for the chronic diseases that we cannot even contain in today's world. So not only will we be able to manage diabetes, we'll be able to cure diabetes. We'll cure Alzheimer's, we'll cure cancer. And so, in a real sense, there is some truth to that. and yet, what I'd say in response to that is that, by curing these various chronic diseases, which is itself a good thing to do, but by focusing on greater economic growth, which is greater GDP growth, we've kind of missed the purpose of which we are striving for, which is in increasing our well-being and our happiness. And by pursuing ever greater GDP growth, maybe we'll become increasingly productive. But by continuing to be sedentary as we are, and thereby enabling us to become productive, that doesn't translate to an increase in healthier lifestyles. So that doesn't mean that we are going to be exercising like we should be, that we're going to eat a healthy diet, that we're going to get adequate sleep. Those things to us are already free to us. In other words, those things are already available to us in today's world. We don't need some sort of technological innovation to get to implementing that, right? I mean, we just need to take advantage of the fact that that is available to us, if only we were free enough to be able to do that. Now, we're unfortunately tied to a certain sort of living, which is a hazardous form of living, which is modern day employment, where we're stuck to a desk from 8 to 5, followed by sitting through traffic to and from work for years or even decades on end. And so despite the increasing productivity, our health is in decline. And the fundamental reason we're seeing a drop in levels of happiness over the last few decades is actually driven by the decline in our health and the rise of chronic disease.
Yeah. And, speaking of jobs, there's studies to talk about how to be really happy at your job, you need a combination, hopefully both, of having autonomy or agency, and then also having purpose, right? You need these things.
That's right.
If you're always told what to do and you feel like there's no reason to do it, you're not going to be happy. If you have a little bit of wiggle room where you can do some things that you think are important and you think you're helping, and you have that agency and purpose, then that's going to lead to success. How do we get more of that? Who does that well, and how do we copy that?
Yeah. So that gets to the fundamental point, which is the sort of the solution that I talk about in the book, which is, if we are aware of this concept of mindless consumerism, that is that, once you've met your basic needs, that the best things in life thereafter are free. And again, there's a lot of caveat there that I'll have to reference you to read the book to get to that. But you'll get to that point. And once you see that, what you'll realize is that you can do a lot more. You can put away a lot more of your money into investments than the typical financial advisor would recommend. So if you talk to most financial advisors, they'll say to put away 10% or 20%. And that's fine if you're going to retire late in life and oftentimes with a lot of chronic disease. But, what I'd like to suggest is for most of us, if, we are aware of this notion of mindless consumerism, and we decide to take control of it, then we'd be able to put away at least 30%, maybe 70% of our income, and invest that so that you can get to the point of becoming financially independent of your employer. Now, that doesn't necessarily mean that I recommend or that I hope that people will then retire. I hope that they don't. I actually think that there's a lot of value to work beyond that. But it gives you a sort of freedom from which you can live the sort of lifestyle that you are inherently capable of.
Yeah, I think their stat is, and don't quote me on this, something like 14% of people own a car that's worth more than what they make in 1 year. So
Oh,
to me, that
yeah.
seems absurd. My wife, full disclosure, is a pediatrician. We're a one car family, and it's not a fancy car because
Wow.
it's not an asset and it only depreciates. And there's no point of having two or three cars in our family. We work fine with just one car. And I think
That's right.
leading to these sorts of lifestyles are
Mm.
important down the road. It's difficult to get people to do that because there is a sort of a keeping up with the Jones going on in our society, and with social media and everything else. It's I guess I would say I'm maybe less optimistic than you that there's going to be a turnaround. But before we get to your optimism, or lack thereof, I want to talk about the retirement, because you just hit on that. There is also like a new wave thought of, well, there's chronic diseases. I don't know if I'm going to be living till I'm 70. Why don't I just take short-term vacations so that I could live it up a little bit and not worry about stacking that money away? What's your thoughts on that?
Yeah, I mean, most people probably are dependent on their paycheck on a month-to-month basis. Unfortunately, that even a short-term mini vacation or mini retirement, I think it doesn't seem plausible for a lot of folks. I'd like to suggest that's very plausible if again you buy into this notion that once you get past your basic needs, that the best things in life are free, and then invest the rest of that income. Let me just kind of add to something you said, which is about how we tend to overspend on cars. Just to add another dimension to that, look at the size of houses over time. And if you look several decades back, our houses now are almost 3 times the size it was in the 1950s, and yet levels of happiness have actually declined. And so it just kind of speaks to as a society, in US society, our levels of happiness actually declined. And so it kind of speaks to the notion that, a lot of our spending is intended to increase our happiness, but is actually reverse. The reality is reverse of that.
Can we discuss pay for performance? You talk about this in your book. Now that we are kind of talking about jobs and money and all of that, I think it's a good time. What are your sort of macro and micro thoughts on pay for performance, and how do we fix that? And what's a better alternative if you don't like pay for performance?
Yeah, that's great. Daniel Pink, who does a lot of research and on this, really kind of spoke to this in a way that it's really revealing, which is pay for performance works at a very rudimentary level where if you don't require a lot of cognitive skills, maybe just routine work, for example, where you don't have to think about things, then paying more translates to better performance. Whereas once you have even the most rudimentary of cognitive skill involved, then paying more doesn't improve outcomes. Actually, performance seems to go down in a lot of cases. And so even though it strikes us as obvious almost that by paying more for performance, we should be able to improve performance, it's quite the contrary in those cases where more than rudimentary cognitive skills are involved. So what I'd like to suggest is that there's a better system, which is that if we can get to the point where we are no longer dependent on our income for our daily expenses, for our daily living, our day-to-day living, then our performance takes off in a way that it cannot, because we tend to now focus on extrinsic rewards, which is money, right? And so when you take money off the table by being financially independent, your performance actually takes off to a different level of performance. I oftentimes hear folks comment on people like Elon Musk and how what a genius he is, right? And I don't want to take away anything from Elon. He really is a genius in a lot of ways. But I'd like to suggest that a lot of us here, a lot of folks listening here, are have some sort of genius within themselves. They just never had the chance to look up and see things from a perspective that very few in today's world actually get to, which is the point of financial independence. where you can afford to actually look up, where you have the time to be able to say, hey, you know what, maybe I don't want to do this particular thing. I want to focus on this aspect of my work. And maybe that's not what the boss wants, but that's what you want to do. And you have the leverage to be able to do that. Then you actually start to see things in a way that you can't when you're tied to a desk from 8 to 5, Monday through Friday, decades on end. So I'd like to suggest it's a better way of living.
Let me walk you through this hypothetical here. And now that we're, my brain is going, now that we're talking about this pay for performance, and we mentioned before, sticks and carrots, how do we get people to do the right things? And I think it's already been tried before. I'm not sure successfully or not. And I don't know if there's, again, this is going to be your wheelhouse, if medically, like this is like against what one would do as a practitioner or what medical insurance would do. But why isn't there sort of a very regimented tiered structure of what people are paying for health insurance based on their health? And I'm not just talking about BMI, which again is sort of, I have another question for you. Why do we use BMI? To me, it's so antiquated. We have better variables to use to measure somebody's health, but why aren't there 15 markers of health that we all agree on? And then we go, okay, if you meet, let's say 13 of these 15 markers, you basically pay nothing for health insurance. And if you're smoking, then you pay more. And there's sort of like a tiered system. Would that work? Is that not okay because it maybe it benefits the affluent?
It sort of is the system that we kind of went away from. So there was sort of a tiered system to the extent that chronic diseases were often a exclusionary criteria for getting insurance in the first place.
Okay.
I'm not sure that really kind of helped us to get control of chronic disease any more than it does now. With respect to BMI, that's a interesting comment. Yes, BMI is not the most accurate measure of our health status. In fact, if you look in men, particularly for men, it's somewhat inaccurate. If you look at folks who have a lot of muscle mass, they're going to have an elevated BMI. But the problem is BMI is actually a pretty good measure in our population in the US. And the reason for that is because we don't have an epidemic of bodybuilders. So in other words, if you're overweight, chances are it's not because you're a bodybuilder. It's usually because of certain aspects of our health, which are not good. So.
Yeah, I mean, listen, that makes sense to me. I get it. You're right. It's not like everybody. It's not like everyone going to the doctor's office is coming in looking like Arnold Schwarzenegger, and he goes, exactly. "Hey, just on my neck's big. I lift a lot. That's why I have high BMI." But I just felt like it was a bit antiquated. But staying sort of in this medical system, because a lot of the book again is about consumerism and how that plays into it, and how we need to make better choices for ourselves. Mm-hmm. But there's also, there are problems in all of our systems, right? And that's what we do best as humans, is locate those problems and fix those problems. And I think, talking about in the book, you talk Sam as your avatar patient, right? And Sam, I'm going to make this up, and you can correct me if I'm wrong. Maybe he's like mid-50s. He's your maybe typical CEO, works too many hours. Has a few beers on the weekend, isn't really paying attention that much to his health. Maybe he eats a salad, for lunch, but it's covered in bad dressing anyway. So that negates the salad anyway. Sam is my avatar personal training client. And, I think where maybe the process goes awry is that we check in with Sam, we being, let's say, the medical, the general practitioner. Sam is overweight. And Sam is now told, okay, you need 30 minutes of exercise a day, and you need to, stop eating butter. Sam comes back 6 months later. He's got high cholesterol. Okay, take this Lipitor pill and out the door, right? So we're so focused on medication. It's pretty much the second intervention. And how do we solve that problem?
What we're doing is placing increasingly sophisticated bandages on our patients, right? If you think about it, and as you read about in the book, 70 to 90% of these chronic diseases surprisingly, are preventable.
Hmm.
And so at some level, you're marveling at some of the technological sophistication we have. I think of cardiovascular surgery or neurosurgery.
Yeah.
At some level, cardiovascular surgery is just so impressive, the things that we could do now. And yet, what if we had prevented that patient from having coronary artery disease in the first place?
Yeah.
Wouldn't that have been a lot better? Instead of, using increasingly sophisticated technological band-aids that, temporarily gets you feeling okay enough to get back to the unhealthy lifestyle that brought you to the medical system to begin with. What if we actually prevented chronic diseases?
Does that, though, start with the medical system? Meaning, if I am a general practitioner, I tell my patient, hey, this is what we have to do. This is how you're going to be healthy. This is how we have preventative care. And then also from the health insurance side, this is how we support preventative care so that people can become healthy. Because, I'll say this might be a long-winded way of going about this, but doctors, medical doctors, DOs, MDs are very humble. They almost never introduce themselves as doctor. If someone introduces themselves as doctor, they're probably like a PhD in like German dance philosophy or something, right? So that's my experience anyway. So, and because doctors are always surrounded by other physicians and they're always comparing themselves to other physicians, they're very humble. But what I think they don't see, why that's a blessing and a curse or double-edged sword, is because the rest of the general population sees you guys as like omniscient. And whatever the doctor says, it's final. So if the doctor says take Lipitor, it's over. I don't need to fix myself. I just need to take the pill, and the medicine fixes everything. And I'll even add to that Dr. George, I don't have a client, or I hate talking absolutes, but I would say 80% of my clients are on zero medication or they're on a ton of medications. Because once you take one, you go, it fixes everything. And then you just continue to take medication. So I guess, that was a long-winded way of saying, do we need the medical community to really be leading this march rather than just the general population?
I think so to some extent. Of course, that advice of healthy diet and exercise are definitely those fundamental pillars of good, healthy living. And so, you can't get around it. It's not like you can skip that part, right?
Yeah.
So that's still fundamentally important. But there are some real impediments to for most people to be able to implement that in their lifestyle, right? Again, if they are stuck in their tied to a desk 8 to 5, and plus traffic to and from work. Oftentimes most of my patients, I try to talk about this, they have good intentions. They'll say, hey, I'm going to definitely follow through on the healthy diet, exercise.
Yeah.
But they come back and it just doesn't get implemented because, they're in a rush oftentimes. They don't have time to prepare a nourishing dinner. Lunch is often on the go. Breakfast, if anything, if they get breakfast, it's a breakfast taco or a coffee. There's not enough time for real nourishing food. And so, combined with the sedentary lifestyle, this is really a health hazard in a way that a lot of folks don't recognize and appreciate.
Yeah, there's a work-life balance problem that goes on in life now, more so than ever, to the point where people are burning out. And I think part of the issue is what you said before. I think some people just can't afford to not have the next paycheck, and that's a problem. But then we have to look not only, I think people tend to not look externally, also what you say in the book, and say, where can I cut from? Do I need to live this lifestyle? Do I need to live in this big of a house? Can I cut from other areas to have a healthier work-life balance, which in turn means that I'm eating the right foods, my body's healthier, I don't have to worry about chronic diseases, and all of these things sort of snowball together to make you a happier, healthier person. And that's really the thesis of the book.
That's right. Steve, there's a famous economist that a lot of your listeners will undoubtedly know, John Maynard Keynes, who is a Depression era economist in the 1930s. He famously predicted that in our time, that this, 2020s, 2030s, that we would only need to be working 10 to 15 hours a week because our productivity would increase to such an extent, which in fact it has. we are much more productive than those who lived in 100 years ago, in the time that Keynes predicted this.
Sure.
He was wrong, but I'd like to suggest he need not have been wrong, right? In his time, actually, most people had a single person income. Most families, right, as opposed to most families now, both parents work, both the mom and dad both work, right? And yet somehow are still struggling to be able to make a living on a paycheck to paycheck basis, and we shouldn't have ever gotten to that extent. And again, step back and see that the types of cars that we have, the types of houses that we have, the enormous amount of spending, which isn't translating to increase in happiness. If it was, then that's justified. That's perfectly fine. But in fact, what we see, and as I display in a graph in the book, despite the ever increasing GDP trends, levels of happiness have actually declined in the United States, in particular, in these last few decades.
Yeah, and that seems unbelievable, but it is the truth. However you're measuring happiness, and I see everything now through the lens of a parent. I just became a parent 5 months ago, and so I want to talk a little bit about that, because a burden that a lot of people have are financial decisions that weren't necessarily theirs, meaning like they came from a background in which the parents didn't make good decisions on their behalf, and one of them is, at least in my opinion, that's why I'm gonna throw this to you, is college. Do you think that everybody should go to college? Do you think that we should have more trade schools? Do you think that there is this looming issue of college debt? Is this something that is leading towards this unhappy lifestyle?
Yeah, first of all, congratulations, by the way, Steve.
Thank you.
That's awesome. I would say that everybody who wants to be able to go to college should have the opportunity to. That doesn't necessarily mean that everybody should. Mm-hmm. But this college debt situation that we're in right now is very unhealthy. So that right off the bat, oftentimes, and unfortunately, our young high school students, graduates, they're not they don't get a good financial education, and so when they're comparing colleges, let's say, they might opt for the most prestigious one, or where their friends are going, or some college where they don't necessarily take into account the level of debt that they're going to get into. And this is a problem, because right off the bat, they're going to be in a financial hole. And as a result, to climb out of that is much tougher than if they have, maybe opted for a little bit less expensive of a college experience, where they are able to keep from ever getting into that situation in the first place. So, I'd like to suggest that we could really do a better job if we can really kind of implement some bit of financial education in the high school, college level that is likely to translate to better decisions on a financial front.
Now, my opinion, reading the book, and you can tell me if you're wrong, is you seem to sort of be glass half full, that things are going to turn around, although there are problems. Is that not the case? Is there a ideal world where we're more in this 1950s family-centric, maybe 1970s community gardens and these sorts of things, and we're all kind of working in concert and things are better, or do you think it is an uphill battle?
So I present a hopeful vision, which is different from an optimistic vision. So an optimistic vision is that, just kind of sit back and things are going to get better. That's actually sort of what Steven Pinker seems to suggest in his book in some ways. But I think that actually we have to change the situation. And change takes real effort. There's nothing guaranteed about change. And so is it possible to get to that sort of a state in which we as a society are doing much better? I'd suggest that absolutely it is possible. It takes some policy interventions, which I talk about in the book, to be able to get to that level. So one of which is what I just talked about, which is, that financial education that we have to implement at at a younger age, in fact, in high school, in college, to where people actually learn these principles, and also the principles of which of how happiness is affected by, what sort of things actually affect well-being and happiness. If we could teach that, that itself is again, one of the policy prescriptions whereby we can, as a society, actually get to a better level of way of living.
Now, I want to do some rapid fire thoughts here. I'm going to say 4 or 5 words. You can give me the first thing that comes to your mind and what you think about it in sort of like a 30-second elevator pitch kind of deal.
Mhm.
Okay. And if for some odd reason you don't know what I'm talking about, we'll just pass. We'll go to the next one.
Ready.
Artificial intelligence in the medical fields.
So again, it kind of points to the notion that we need to rely on technological solutions for improving our health, when in fact, a lot of what we need is available to us right now. Healthy diet, exercise, good sleep, managing stress. Those are the pillars of healthy living. We have that available to us. We don't need any technological innovation to get us to that point. That said, yes, there is some definite benefit behind AI and using that in medicine to improve certain things that we can't prevent.
Cash-only doctors.
Pass. So,
Yeah.
I don't think there's no with that. The only problem, a lot of specialists are very expensive. A lot of procedures are very expensive. You'll just not get to a level of coverage that is adequate for the population relying on cash-only docs.
Universal healthcare.
Universal healthcare is a good thing to try to strive for. That doesn't necessarily mean government-run healthcare, so you don't necessarily have to confuse the two. I do think we need to be independent of our employer for our healthcare needs, for health insurance. Right now, we're largely still tied to an employer-based health insurance system. I do think whether that's run by the government or private entities, that we should be striving for a universal coverage without regards to tying to our employer.
Last one here, universal basic income.
Universal basic income won't solve the problem of consumerism. So, give a person in the middle class on up more money, that's not going to get them to purchase, not chase after purchasing bigger and bigger houses or fancier and fancier cars. That's not going to solve that problem. It will help for those folks who are below a certain poverty line to be able to meet their daily expenses. So in which case you don't necessarily need it to be universal. But
I want to tell all the personal trainers and fitness professionals out there, which is the vast majority of my audience, that this book is so useful for you because these are our clients. Most of our clients who we work with are people who have the money to work with us. And if they have the money to work with us, they're not always treating their body in the right way. They're the people who are working 55 hours a week. They're the people who are maybe hitting it hard on the weekends, the weekend warriors, as far as going out and partying, and they live different lifestyles. And it's important that we know and that we can help our clients from sort of a wholesome perspective, right? That we're not just helping them for that 1 hour in the gym, that we understand their lifestyles and how we can maybe even coax them into saying, hey, I know you've canceled on me twice, Larry, but you have to understand, if you're canceling on me, you're also canceling on your health, right? You deciding to stay that 1 hour extra at work all the time and not coming to me means you're prioritizing your money over your health long-term, which is going to lead to diseases, which is going to lead to a bad relationship with your family and things of this nature, right? So it is imperative that we understand that we have to hold our clients accountable. We have to understand their lifestyles. And that's why I think this book is very fitting for fitness professionals to read.
Hey, thank you so much for that, Steve. I really appreciate that. And I really appreciate the good work that you're doing with all your clients there and the message that you're promoting.
Thank you. I appreciate that. And so why don't we let the listeners, Dr. George, know where they can find your book and everything about it?
Sure. The book is called Health in Flames, A Doctor's Prescription for Living Beyond Diet and Exercise. You can find that on any of the major retail websites, from Amazon to Barnes & Noble's, Apple, or any of the major online retailers. You can also go to healthinflames.com to get more details. I do have an ask of those who read the book. to one, hopefully you enjoy it, and please leave me a review. That would be help to increase the visibility of the book. 2, request it at your local library, because I'm more interested in getting the message out there than making a ton of money off the book. And then 3, there's a place on the website where if you really want to get involved to help bring about benefits at a greater level for a society as a whole, there's a place on the website. You can contact me. I'd love to hear from you. Thank you so much.
Yeah. Lastly, I just want to say, the book really balances anecdotes and information in a good way, where it's not like you're just reading his perspective, Dr. George's perspective. There's science, but it's not like you're reading a very difficult scientific paper, right? It balances those two perfectly and sort of interweaves them to make a great story. So it's a great read. My guest today is Dr. George. Thanks for joining the Trulyfit Podcast.
Thank you so much.